don't sit on the table, right? Nope. And this way is easier because you are not pulling with your arm, you are holding it and then rotate your body to actually feel the pull, right? So you can hold it, or like you can do the oscillation. But like for the long axis, the sustained blind works better. And the most effective one for the frozen shoulder is the lateral gap, right? So you're gonna have the towel around it, and then you're gonna place in dip, right? And your force to the lateral side is not like this. This hand is stabilizing while I'm pushing out. So you're gonna move kind of together like that way, not like this way, right? And then you're gonna push it out, and then sustain blind, or you can perform the oscillation here if you want to. And then what they need is gonna be the abduction and then the external internal rotation, right? So then anterior posterior glide and then the inferior glide is necessary for that one. So you need to keep in mind that you may need to perform the anterior glide of the humerus on the scapula in the prone position. You have to do it in the prone for the joint mobilization, for the anterior glide. And then the rest you can do it in the supine. So while you are treating all the muscles, at the end you may need to finish up with the anterior glide of the joint mob, and then you can flip them over to finish the rest of the joint mobilization techniques, right?
But then the most two important techniques are the traction and the lateral glide.
Lateral gap, yeah, and then you can perform the anterior posterior glide and the inferior glide. Like all of those is an option. But like if your patient are in a freezing stage, so then I would go with the more gentle ones, so long axis traction and the lateral gap only yet, because the stiffening is not very bad yet because it's more the pain. So my target is decrease the pain at the grade capsule, which is using the grade 1 or 2 only. So when it comes to the frozen stage or even thawing stage, there is a complaint about the stiffening and then the limited range of motion. Then now you have to do like all set of the joint mobilization for the patient to make the effective treatment. Okay, that's the difference. So it's anterior glide. So it's gonna be the posterior glide, right? So you're gonna stabilize the proximal side, so you can hold onto here, and then go like from there to feel the grade, and then you're gonna perform. And then the oscillation works better with gliding, so you can perform the oscillation to actually make it better, right?
It's more like vibration, feels like.
Yeah. So the oscillation is like that. So when you think about that, like the 1 and the 4, it's gonna be more the fine vibration, versus the 2 and 3 is more the coarse vibration kind of movement. And then the inferior glide is better to do it in a abduction, right, to the 90 degree of the way, and then you're gonna perform like that way, right? So then you need to make sure that your patient can reach to the 90 degree abduction while you are performing the assessment, right, active range of motion. If your patient already complaining about, oh, I feel pain here, so then can you perform the inferior glide? Like that, no, right? So you need to wait till they reach the point of the 90 degree-ish of the abduction, then you can do it, otherwise you cannot, right? So that's the thing, like if you get the information from the assessment, you gotta use the information during the treatment, right? If you fail to do so, there's a deduction of the marks, right? Here you are. So you're gonna copy the head of the humerus, and then go like this. This one is the same thing too, you are not pushing like this way, right? This one is stabilizing, but when it moves, it's gonna move together a little bit, so you are not pushing the bone like this way, cross way, right? Is that okay?
What
Is that
about